Namaskar world and welcome to our channel. Today we're diving into an important but often misunderstood health topic, hemolytic uremic syndrome or HUS, caused by the E. coli bacteria. This is a serious condition that can lead to kidney failure and other complications, especially in vulnerable populations like young children and older adults. With recent outbreaks of E. coli tied to popular food chains, understanding HUS has never been more relevant. Hemolytic uremic syndrome, or HUS, is a rare but severe condition that affects the blood and blood vessels, primarily causing kidney failure. It is most often associated with Shiga toxin-producing E. coli, STEC, especially the strain E. coli O157, which produces a toxin that damages blood vessels, especially in the kidneys. The association between E. coli infections and HUS was first identified in the early 1980s. Researchers found that certain strains of E. coli were producing toxins that could cause severe, often life-threatening complications. Since then, HUS has been extensively studied, especially in relation to foodborne E. coli outbreaks. The primary cause of HUS is infection with Shiga toxin-producing E. coli, STEC. Once inside the body, the toxin targets small blood vessels, causing red blood cells to break down, which can lead to acute kidney failure and damage to other organs. In recent years, foodborne outbreaks, like the one involving McDonald's in the USA, have highlighted the risks associated with STEC. HUS is relatively rare, but it's one of the leading causes of kidney failure in children. Outbreaks can occur globally, but certain countries with widespread meat and fresh produce consumption experience more frequent cases. In the USA alone, there are around 70,000 STEC infections yearly, and 5 to 10% of these may develop into HUS. When Shiga toxin-producing E. coli enters the body, it binds to receptors on the endothelial cells in blood vessels. This toxin triggers a cascade of events, including inflammation, blood clotting, and red blood cell destruction. The kidneys are highly vulnerable because they have many tiny blood vessels, making them prime targets for toxin-related damage. E. coli is typically transmitted through contaminated food or water, such as undercooked meat, raw vegetables, and unpasteurized dairy products. Infections can also occur through contact with animals, like in petting zoos or farms, and from person to person if proper hygiene is not maintained. The recent McDonald's outbreak in the USA linked to E. coli emphasizes the importance of food safety. The initial symptoms of HUS can resemble those of a typical gastrointestinal infection, including stomach cramps, diarrhea, often bloody, and vomiting. As HUS progresses, signs may include extreme fatigue, pale skin, reduced urine output, swelling, and confusion. These are signs of kidney damage and should be treated as a medical emergency. HUS is diagnosed through a combination of blood and urine tests. Blood tests reveal low red blood cell count, low platelet levels, and signs of kidney impairment, such as high creatinine. A stool test is also often done to confirm the presence of Shiga toxin-producing E. coli. HUS symptoms can overlap with other conditions, making differential diagnosis crucial. Doctors may need to rule out other causes of acute kidney injury, such as thrombotic thrombocytopenic purpura, TTP, and other forms of glomerulonephritis to confirm a diagnosis of HUS. There is no specific treatment for HUS caused by E. coli. Care is supportive and may include fluids, blood transfusions, and dialysis if kidney function is impaired. Antibiotics are generally not recommended, as they may worsen toxin release. Researchers are actively studying potential therapies to neutralize Shiga toxin and protect the kidneys from damage. Most patients with HUS, especially children, recover fully with supportive care. However, long-term kidney damage can occur and around 10% of cases are fatal. Adults and individuals with weakened immune systems are more likely to suffer from severe complications. Complications of HUS include kidney failure, high blood pressure, and in severe cases, neurologic issues such as seizures or strokes. These complications can have lasting effects on health, especially if not treated promptly. While HUS is rare during pregnancy, it can pose serious risks to both the mother and the fetus, including increased chances of miscarriage, preterm labor, and maternal kidney failure. Thus, pregnant women should be vigilant about food safety to avoid infection. Preventing HEMOLYTIC starts with minimizing the risk of E. coli infection. Here are some simple steps. Cook meat thoroughly at recommended temperature, especially ground meat, until the juices run clear. Avoid unpasteurized dairy products and juices. Wash fruits and vegetables under running water before eating. Practice good hand hygiene, especially after handling animals or visiting petting zoos. And be cautious about food safety, especially when dining out. In a recent outbreak tied to McDonald's in the USA, health officials linked several cases of E. coli O157H7 strain infection to contaminated slivered onions used in quarter-pounder hamburgers. The number of people infected have increased to 75 till now. Of the 61 on whom information was available, the health regulator said 22 persons have been hospitalized. 2 of them have developed hemolytic uremic syndrome, resulting in death of 1 person. This underscores the importance of food safety regulations and the need for vigilance in food handling practices, both at home and in restaurants. In summary, hemolytic uremic syndrome caused by E. coli is a serious but preventable condition. By practicing food safety and hygiene, we can reduce the risk of this potentially life-threatening illness. Remember to stay informed, make safe food choices, and share this information with friends and family to help keep everyone safe. You may also want to watch our video on safe meat consumption during festivities. Link is given in the description. This video is brought to you by Dr. Rajdeep Bahadur, Khatri. If you found this video helpful, then don't forget to like, share, follow and subscribe for more content like this. Stay informed and stay safe.